I'm Dr. Paul Summergrad, the Dr. Francis S. Arkin Professor and Chairman of the Department of Psychiatry at Tufts University School of Medicine and Psychiatrist in Chief at Tufts Medical Center. I'm going to be talking with you this afternoon about, are we ready for psychedelics? So the first learning objective is to evaluate the role of psychedelic agents for the management of mood and anxiety disorders. So this is some of the context of the new research that's occurring in these agents. A variety of agents have been studied, often requiring complex approval processes due to historic restrictions. Many of these pharmaceuticals are on Schedule 1, which requires special approval. Among these are LSD, MDMA, ayahuasca, and psilocybin. And the most studied for clinical purposes currently are psilocybin for mood and anxiety disorders and MDMA for PTSD. And there are also some imaging studies that are occurring primarily of psilocybin and LSD. Thinking about the prior issues and use of these agents, there's a complex past history. In many areas of the world, many of these agents are natural compounds, such as psilocybin, and have been used by tribes in different cultures, often as part of their established religious rituals. There's also been widespread non-clinical use, especially in the 1960s and elsewhere. In the last number of years, though, really over the last 10 years or so, there has been increased formal scientific research on a number of these agents. A set of studies that was published in the Journal of Psychopharmacology in December of 2016, both from Stephen Ross and the NYU group, as well as the group from Johns Hopkins, looked at rapid and sustained symptom reduction following psilocybin treatment for anxiety and depression in patients with life-threatening cancer. And in these randomized studies, patients either received placebo in one case or a subtherapeutic dose of medication in another case, often with intensive preparation and psychotherapy. And the results in both of these studies were dramatic. People really did extraordinarily well with rapid and sustained reduction in their anxiety and apprehension, often lasting for months. And as you'll see, we'll talk about in a minute, many of these, there's been some recent follow-up work suggesting that for some subgroup of these patients, these improvements have been sustained. There's also been psilocybin treatment-resistant depression proof of concept trials, some of which are now being moved into formal clinical trials. This is work by Robin Carhart-Harris in London. The inclusion criteria for this study were major depression of a moderate to severe degree greater than 17 on the 21-item Hamilton Depression Rating Scale, and no improvement despite 2 adequate courses of antidepressant treatment of different pharmacologic classes lasting at least 6 weeks within the current depressive episode. Subjects in this small study received 2 oral doses of psilocybin, either 10 milligrams or 25 milligrams, 7 days apart, in the kind of supportive setting that I mentioned. While there were some adverse reactions, they were generally transient anxiety during drug onset, some transient confusion or thought disorder as the drug was coming on, mild or transient nausea, and transient headache. Relative to baseline, depressive symptoms were markedly reduced at 1 week with a QIDS difference of minus 11.8, which had a Hedges G of 3.1 and a p-value of 0.002, and were sustained at 3 months with a p of 0.003 after the high-dose treatment in particular. Marked and sustained improvements in anxiety and loss of a sense of pleasure or purpose were also noted. And this shows some of the detail of these studies, and you can see that for all of the measures, there was a substantial and significant and statistically significant improvement in both the KIDS, the BDI, the HAM-D, and the MADRS. Now, there are some newer studies that have also been done of psilocybin, other psychedelics, and MDMA. One of the most interesting, which was recently published by Stephen Ross and the group, again from NYU, as well as others, was a follow-up to the Ross study from 2016, which showed large-scale reductions of 60 to 80% in anxiety and depression at 6.5 months post-trial for cancer patients. Of the 16 cancer patients who were still alive at follow-up, 15 participated at follow-up at 3.2 and 4.5 years for the two different studies. And as you can see here, that over the course of this time, remission rates remained very high, both on the HADS and the BDI, and on all measures, response rates remained very high over this relatively lengthy period of time. And for persisting effects of the psilocybin experience, which people had described, the vast majority of individuals noted that the experience was personally meaningful, spiritually significant, led to positive behavior change, and well-being and life satisfaction. Many individuals endorsed the comments that these were among the top five or the single most personally meaningful experience or spiritually significant experience of their lives. And this is, again, from one administration of agent with psychotherapy follow-up and support just around the initiation, the administration, and the wrapping up of the treatment session. 96% of all individuals rated the experience among the top 5 most meaningful in their lives. A different compound, which is not a formal psychedelic, is MDMA for PTSD. MDMA, which has also been a drug of abuse, known as Molly's, is a drug which acts by a certain amount of reuptake inhibition, but also is strongly associated with the release of oxytocin, which seems to be associated with part of its feeling of calm and connection to other people. And in a study of MDMA-assisted psychotherapy in veterans and first responders with chronic PTSD, a randomized clinical trial of service personnel greater than 18 years with chronic PTSD duration of 6 months who had CAPS PTSD scores greater than 50. They were randomized to MDMA and psychotherapy 30 milligrams, 75 milligrams, or 125 milligrams, which were administered orally in 2 8-hour sessions with psychotherapy. And as you can see, particularly for the 75 milligram dose and the 125 milligram dose, there was a significant improvement of people in terms of their mean CAPS total scores. And the drug was effective and well tolerated in reducing PTSD symptoms in both veterans and first responders. There's also been a meta-analysis of prolonged exposure, which is another traditional treatment for PTSD versus MDMA. And as you can see here, both of these had positive and relatively similar outcomes, although there was in this study a slightly greater tendency towards dropout in the prolonged exposure group compared to the MDMA group. So a couple of cautionary notes. These compounds have important value in understanding the neural networks that support a well-delineated sense of self and other, and potentially in understanding antidepressant or anxiolytic mechanisms of action. Neuroimaging studies, however, with psilocybin and other psychedelic agents are really in their early stages. I think it's important to recount that many participants rated this experience among the most meaningful of their lives, and the benefits of the experience in some of these larger settings on mood and anxiety continued for months, and now we have data for years. Despite single administration and serious medical conditions, we're really waiting, though, on larger scale studies to see how effective this is going to be for treatment-resistant depression or other conditions. Given the strength of these findings, it's really important that more extensive studies to replicate these outcomes are called for. It's difficult, as you can imagine, to blind these agents adequately, so consideration needs to be given to including research groups that have had less prior involvement to reduce placebo responsiveness, and the complex history and legal status of psilocybin and related agents suggest additional thought be given as to how to deal with the unique legal, ethical, and regulatory issues surrounding clinical use of these agents. While very preliminary clinical data support the use of psychedelics for the management of treatment-resistant conditions, clinicians should proceed with caution, recognizing that more extensive studies are both warranted and currently underway. Thank you very much, and appreciate the opportunity to talk with you.